For this video, we will be talking about the genera Haemophilus and its important species. We have our Haemophilus influenzae, Haemophilus parainfluenzae, Haemophilus aegyptius, Haemophilus haemolyticus, Haemophilus parahaemolyticus, Haemophilus aphrophilus, and your Haemophilus paraphrophilus. The word Haemophilus came from the Greek words hema and philo, hema and philo, meaning blood, hema meaning blood, and philo meaning lover. They are gram-negative pleomorphic coccobacilli or rods. They are also non-motile and they are facultative anaerobe. And lastly, they are an obligate parasite of the mucosal membrane in humans and animals. Your Haemophilus species ferments carbohydrates. They reduce nitrate to nitrite. They are oxidase positive and catalase positive. The Haemophilus genera has 13 species, but only 8 are clinically significant. So your Haemophilus requires supplementation in media with one or both substance. What are these substances? So you have your X factor. So X is for unknown, having or containing hemin or hematin. And then you have your V factor, V for vitamin, having your NAD or your nicotinamide adenine dinucleotide. Let's start with your Haemophilus influenzae. So this is also known as your Pfeiffer's bacillus in 1892. It was discovered or founded by Richard Friedrich Johann Pfeiffer. It is considered as the major pathogen, and it is subdivided in 8 biotypes, so from 1 to 8. Please note that your Haemophilus influenzae is differentiated by 3 biochemical reactions. These are your indole, urease, and your ornithine decarboxylase activity. One virulence factor of your Haemophilus influenzae is your Haemophilus influenzae's capsule. So it has a molecular weight of more than 150,000 daltons. It is the most significant role for its virulence. So you have 6 antigenically distinct types from A to F. And the most invasive and most common infection is caused by your encapsulated strains. And that is your Haemophilus influenzae serotype B. One more thing, not all are encapsulated. Okay, not all Haemophilus influenzae are encapsulated. Therefore, we term them as non-typable H influenzae. Another virulence factor of your Haemophilus influenzae is that has your immunoglobulin A protease. So this immunoglobulin protease has the ability to cleave your secretory IgA. So it easily colonizes or invades mucous membrane. Next, we have our Haemophilus aegyptius. It is also known as your Cockwicks bacillus, founded in 1883. Is associated with acute contagious conjunctivitis, or here in the Philippines, we most commonly know it as your pink eye. Next, we have your Haemophilus influenzae type 3. So this is your Haemophilus influenzae biotype aegyptius. This is the causative agent for your Brazilian purpuric fever. Okay, you have to remember this, that it is the causative agent for Brazilian purpuric fever. It is known to have symptoms such as your recurrent, concurrent conjunctivitis, vomiting, high fever, petechial and purpural rash, septicemia, shock and vascular collapse. Next, we have our Haemophilus ducreyi. So it affects the mucosal epithelium, your genitals, the non-genital skin, and your regional lymph nodes. So what disease is caused by your Haemophilus ducreyi? It causes your soft chancre. This is a chancroid that is highly communicable STD, or your sexually transmitted diseases. So soft chancre or your genital ulcer disease. So your Haemophilus ducreyi is not part of the human microbiota. For your lab diagnosis of Haemophilus, we use your BAP, CAP, and your horse blood bacitracin agar. So these media has your X and V requirement. So for Haemophilus aegyptius, you use your cap with isovitalex or Vitox. Another agar that we can use is your GC agar. So it must be enriched with 1% hemoglobin and 5% fetal calf serum with 1% isovitalex. Again, for your Haemophilus, you always need one or two substances, and these are your X factor and your V factor. For your Haemophilus ducreyi, we use a specific plate, which is your Nairobi plate. This is a GC agar base with 2% bovine hemoglobin and your fetal calf serum and MHA with chocolatized horse blood. Okay, take note that Nairobi plate is for your Haemophilus ducreyi. Next, we have our Levinthal agar. So this is a agar with added blood heated to boiling point. So it is a solid nutritious substrate for cultivating demanding microorganisms. For the microscopic feature of your Haemophilus, you can view them as school of red fish or railroad tracks or fingerprints. Okay? Take note again that your Haemophilus ducreyi is a cocobacilli in loosely coiled cluster lined up in a parallel manner. So once you see a cocobacilli in your gram stain and they are parallel to each other, this is your Haemophilus ducreyi. For the colonial morphology, this is moist and translucent colonies, and it gives off a mousy or a bleach-like odor. Next, we have your porphyrin test, and the goal of this test is to detect the heme-producing Haemophilus species. So what happens here is that it degrades your ALA or your aminolevulinic acid, and through the help of your para-dimethyl aminobenzaldehyde, it would produce a porphobilinogen or your porphyrin. So in porphobilinogen, it will show a positive red color complex, while your porphyrins, it will produce a reddish-orange fluorescence. For Wood's lamp, at 360 nanometers under your porphyrin, a positive red color complex would indicate a negative X factor strip test, and a negative result would mean that it is a positive X factor strip test. In this slide, you can see a table containing your X factor, V factor, and beta hemolysis on BAP results. So this will help you memorize the positive and negative test results of the species for your Haemophilus genera. So what you need to take note of also is your Haemophilus paraphrophilus is that it is ornithine negative, while your Haemophilus parainfluenzae is positive.